Hello, my name is Mark Hartley, and I am the editor of RDH magazine. Earlier today, I had a Skype telephone conversation with Christine Taxin. Christine is the owner of Link to Success Dental Management School in New York State. Recently, she attended a conference in Arizona where insurance companies and experts in dentistry met to discuss electronic health records as part of healthcare reform. Here is her description of that meeting.
Well, at this point, the meeting that I was at, it's called Nindetic, and it has a little nickname called the United Nations. It is because all the electronic companies, the warehouses, the insurance companies, and the software vendors are present at this meeting, sitting at a table, actually having conversations on how they could work together in making things happen for the dental practices across the country in the ease of this transition. They are very concerned about how the small dental practices will transition into electronic. So that's a very big part of the conversation on how we, the industry, can help the small practices make this transition. And one of the big things they're doing is that they're all working together on a universal dental claim form so that it's easier for the office to not have to go crazy looking for the right insurance form for the right company. It also provides a cheaper way for them to help make that transition without having to charge the doctor. So I'm, really pleased with the results of this organization and how they really are concerned about helping the practices financially making this transition, where they're trying to pick up most of the cost in making it so that it's very economical for the dental practice to provide this one universal form electronically.
Well, what is how far apart is everyone on creating a universal claim form? Is it definitely a reality, or is
Oh,
still a
it's
lot
a,
of work to be
yeah,
done?
it's a reality. There is a form already presented to the organization, which has been voted on and accepted. So that's a really good thing. And it's a brand new form, and it has a couple of glitches in it, but it's going to pretty much be the form that they use. That is definite.
How is it? How does it compare to current methods for filing for claims? You think it'll be easier or harder, or is there a learning curve involved?
I think that there's going to be a learning curve for offices that don't submit electronically at this point. The form, however, does have a big change in it. It's going to add 4 diagnostic codes so that with today's industry and the systemic link and connection to diseases, we're able to submit these forms so patients can get that additional benefit if they're diabetic, if they're pregnant. So we're going to have to know diagnostic codes. We're going to be pretty much filling out a similar form to medical.
Ms. Taxin, who frequently writes for Penwell's The Dental Assisting Digest, also has a strong social media presence. Many of her recent postings have focused on stem cell research and related tooth extraction. Since she is a practice management consultant dealing with front office topics, I asked her why this issue was so important to her. Here is her response.
It's really important to me for 2 reasons. One is that I have a child. I have 5 children, and out of my children, one of them was very sick for a long time. And you, as a parent, will do anything when you have a sick child. Anything, whether it's new, whether it's old, it doesn't matter. And you try to find the best solution for things. And when I was approached by Storatooth to help represent them, I was intrigued by the fact that many, many, many children are going to benefit from this somewhere down the line. Just like the storage of the umbilical cord blood is so popular right now with young parents because they see the benefit if their child is ill or someone in their family is ill by having this blood core stored. They have something to help them because we don't know what life holds at all. We never know. And with the storage of stem cells from the teeth, it's a little bit different. You're going to lose baby teeth anyway. You're going to have oral surgery extractions from wisdom teeth. And having the option of storing those teeth on an emotional parent level is like a safety net that you couldn't get yesterday, but you could get today. And the benefits are really being shown so much right now with stem cells and diabetes 1, stem cells and regenerating bone, which has been done already, and stem cells in all kind of future diseases. And I just like pulp regeneration, any kind of cranial facial disorders. And they're working really hard on spinal cord injuries, muscular dystrophy, cornea repair, stroke, Parkinson's disease. And our children are our future. And we as parents will pretty much do anything to protect our children. And so instead of spending money on clothes or things that will not protect them, having the ability to take this and store it for 20 years and have a future for your child, to me, is where I want to help the industry grow.